Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Tobacco considerations. The WHO qualifies as a drug any substance which, when introduced into a living organism, can modify one or more of its functions and is liable to create dependence, and which at the same time causes tolerance. It has been scientifically proven that tobacco, among other things, causes dependence. Tobacco is, therefore, a drug. Physical dependence is considered to be the presence of an altered physiological state that manifests itself when the consumption of the drug tobacco is abruptly stopped, and intense physical disorders may appear, such as the so-called acute withdrawal syndrome, and which disappear when the drug tobacco is resumed. It is also often used as a synonym for addiction. Anyone who has tried to quit smoking understands this perfectly well. Tobacco, therefore, creates physical dependence. Psychological dependence is the irrepressible need to seek, obtain, and resume regular or continued use of the substance tobacco in order to produce pleasure or avoid discomfort, despite the personal costs involved. It is used as a synonym for habit, that is to say, repetitive behavior modified initially by the lack of substance in the body and subsequently by exposure to stimuli and behavior reminiscent of the use. Anyone who has tried to quit smoking understands this perfectly well. Tobacco therefore creates psychological dependence. Social dependence is the need to use tobacco as a manifestation of belonging to a social group that provides clear identical signs. Normally, when one starts smoking, one does so in order to be equal and/or accepted by one's reference group. The adolescent who belongs to a group where everyone smokes will normally end up smoking because of social dependence. Therefore, smoking tobacco usually comes from social dependence. Withdrawal syndrome is considered when there is physical abstinence and the regular administration of the drug tobacco is stopped. A series of extremely unpleasant psychological and physiological symptoms occur. Tolerance and withdrawal often lead to death. The former, because of the constantly increasing dosage, tobacco can cause cancer, and the later because the symptoms become dangerous when consumption of the quantities of the drug tobacco, to which the body has become accustomed, is abruptly stopped. Tobacco therefore creates a withdrawal syndrome when you want to stop using it. Tolerance is the process by which the body becomes accustomed to the continued use of a substance, tobacco, so that in order to achieve the same effects at an organic or psychological level as those previously achieved with a dose of substance, tobacco, it is necessary to take the same amount of the drug, tobacco, that were previously achieved with a minimum dose. The individual must now take a higher dose. In this way, the organism requires progressively more and more of the drug, tobacco. We always start by smoking a small amount and gradually increase the number of cigarettes. Tobacco, therefore, creates tolerance. Cross-tolerance is the phenomenon whereby repeated administration of a substance, tobacco, causes tolerance not only to that drug, but also to another drug of the same time, or sometimes of another pharmacological group. A young smoker is 100 times more likely to try marijuana. Tobacco can therefore create cross-tolerance. According to the WHO, drug dependence is the psychological and sometimes physical state caused by the reciprocal action between a living organism and a drug, tobacco, which is characterized by behavioral changes and other reactions, which always includes an irrepressible urge to take the drug, tobacco, continuously or periodically in order to experience its physical effects and sometimes to avoid the discomfort produced by deprivation. A smoker buys and smokes tobacco on a daily basis. Therefore, anyone who smokes on a regular basis can be considered a drug addict. Tobacco, therefore, it is a drug. It causes physical dependence. It causes psychological dependence. It causes tolerance. It can cause cross-tolerance. It causes withdrawal syndrome when use is stopped. It is usually started due to social dependence. We can therefore consider all tobacco smokers as drug addicts. Not to mention the whole baggage of diseases that can result from habitual tobacco consumption. Serious diseases such as cancer, with fatal consequences, including the death of the smoker. Are you a smoker and have you thought more than once about quitting, but anxiety, nerves, and lack of willpower have always got the better of you? This book can help you overcome your addiction and quit smoking for good. If you're interested in continuing learning about clinical hypnosis, watch our next video, The Physical and Psychological Dependence of Tobacco. Remember to study the description of this video, where you can find a link to free training classes on clinical hypnosis, with several free ebooks as well. If you have questions, ask them in the comments area about this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.